Hello, my name is Rosa Enriquez, and today I will be talking about tropical disease. Tropical diseases consist of the following: malaria, cholera, dengue fever, Chagas disease, the yellow fever, and many more. Tropical diseases can be developed through either bacteria or viruses. The dengue fever, the yellow fever, Ebola, the Zika virus, the Lassa fever were all developed through viruses. A virus is an infectious particle that is only capable of reproducing by infecting a host cell. Mosquitoes, flies, and ticks are the most common carriers of the disease, as they are now hosts for the viruses. Here is a representation of how the Zika virus enters the human body. What tends to occur is that an infected mosquito will enter a household, and the household, a family member will get bitten. As that person gets bitten, the mosquitoes get infected and spread the virus. More family members and community members also become infected. A mosquito will bite a new person, meaning a new mosquito will get infected, and the cycle will go on and on. You may also obtain the Zika virus during pregnancy, through sex, and through blood transfusion. Tropical diseases such as cholera, tuberculosis, and Hansen disease were all developed through bacteria. Bacteria, also known as a bacterium, is a group of organisms that can live anywhere. Unlike a virus, they do not need a host to reproduce. Here is a cholera diagram. The bacteria that causes cholera enters the body through the consumption of food or water that's been contaminated with what we call Vibrio, a bacterium. There is also a more complex organism that contributes to the growth of tropical diseases. It is known as a parasite. Malaria is a development of parasites. Parasites are organisms that live within the host or other organisms. They have the ability to grow in humans and animals. In regions with tropical and subtropical conditions, the transmission of a disease is done through a vector. What usually occurs in the 149 countries that are being affected, the vector will pick up the disease from an already infected animal and then transmits it into another animal, which will later become food to a human. Some diseases may also be transmitted through contaminated water and contaminated food. The million of people that are being affected live in poverty. They do not have the appropriate sanitation or medical resources to get treated. So keep in mind that 1 in 6 people worldwide suffer from diseases you've never heard of. Let's take a look at the symptoms. The identifiable symptoms for tropical diseases vary depending on disease. The immediate symptoms shown despite which disease you have are fever, rashes, soreness, or swelling of the infected area. Let's take a look at a common disease such as malaria. The common symptoms to identify if you have been infected is if you have diarrhea, nausea, or vomiting. Having stomach pain, bone pain, or a fast heart rate, headaches, and mental confusion can be symptoms caused by the infection of malaria. Now, if you compare those symptoms to the symptoms yellow fever has, there is some similarities between them, as well as important differences. For example, you may have nausea and vomiting, but in this case, it will be accompanied by bleeding, yellow skin, and yellow eyes. Let's also take a look at cholera. There's vomiting, there's diarrhea, but we also have the increase of thirst, rapid weight loss, and low blood pressure. It is important to recognize the differences between each disease and what it causes. Now, is there any treatment options? Yes. tropical disease are curable. There is treatment options utilized for each disease individually. Malaria is a treatable disease. It may be treated through medication and antibiotics. The goal of the treatment is to reduce transmission of the infection to others, to prevent the emergence and spread of resistance to antiviral medicines. Cholera disease is also treatable. A specialist will recommend rehydration, intravenous fluids. The goal is to replace lost fluids and electrolytes using a simple rehydration solution, oral rehydration salts. In this case, antibiotics are not part of the cholera treatment, but they can be used to stop symptoms that come with cholera, such as diarrhea and headaches. Although yellow fever is one of the most dangerous infectious diseases, there has not yet been a direct treatment developed. The so-called treatment that has been developed for yellow fever consists of primarily a supportive care in a hospital. This includes providing fluids and oxygen, maintaining an adequate blood pressure, replacing blood loss, providing dialysis for kidney failures, and treating any other infections that develop. You may also use home remedies to treat it. It may not be the most effective way, but you may also try to consume garlic bulbs, dogwood, goldenrod herbs, and increasing the amount of fluid you take. There's interesting information that links cancer and tropical disease. It's been discovered that medication used to treat malaria may be used as a new way of treating cancer. It was reported by Medical News Today that CQ and HCQ, both medications used to treat malaria, can give an interesting anti-cancer strategy when cancer cells begin to devour their own damage and unnecessary components due to the way these medications work. CQ can also help to normalize blood vessels in tumors since CQ is known as a tumor supervisor. Now that you know the difference between a bacteria and a virus, you can take the next few steps to prevent tropical diseases from reaching your home. When traveling, you may consider taking the proper vaccines and medications. At home, keep your space clean. Constantly disinfect areas from your home, especially if you travel a lot. And also keep mosquitoes away. Also, please be aware and mindful that some of the foods we consume can contain tropical diseases. Be very mindful of what you put in your body. Tropical diseases are very harmful and some can become chronic. Once again, there is ways of treating tropical diseases, but it is important for you to identify the symptoms as soon as possible, to get treated rapidly, and to not allow the diseases to expand. Remember, it is a luxury to have clean water and clean food, along with the medical resources to treat these diseases. Let's always keep in mind those underdeveloped countries where people are being infected by these tropical diseases on a daily basis. And thank you for watching. I hope you enjoyed.